If you or someone in your family depends on Medicare, this story is not just political news, it's personal. It's about the doctor visits you rely on, the prescriptions you pick up every month, and the money that stays in or leaves your wallet. A new Medicare payment change linked to former President Donald Trump's policy direction is now being talked about again, and for millions of seniors, it could shape what they pay, where they go for care, and how easy it is to get the treatment they need. Imagine waking up next year and realizing your regular doctor no longer accepts your plan, or your copay is suddenly higher than you expected. That's the kind of ripple effect payment policy changes can create. When the government adjusts how much it pays hospitals, doctors, or private insurers under Medicare, those changes don't stay on paper. They travel straight into exam rooms, pharmacies, and family budgets. This isn't about complicated policy jargon or Washington debates. It's about your routine checkups, your heart medication, your spouse's physical therapy, or your parents' home health visits. Even a small adjustment in payment formulas can change the cost of care or the availability of services in your area. Right now, the focus is on how payment structures could shift, especially in areas like Medicare Advantage, prescription drug coverage, and provider reimbursements. And while some officials say these changes could control spending or improve efficiency, many seniors are asking the same question: what does this mean for me? In the next few sections, we're breaking it all down in simple language. No confusing policy terms, no political spin, just clear explanations of what's changing, why it matters, and what you should watch for next. Because when Medicare rules shift, your financial future could shift with them. What exactly is changing? At the center of this discussion is how Medicare pays doctors, hospitals, and private insurance companies. These payments determine what services are offered, how much providers charge, and how much you end up paying out of pocket. When payment rules change, the entire system adjusts. Under the Trump-era approach, the focus has often been on reducing government spending, increasing private plan participation, and reshaping how Medicare Advantage plans are paid. Medicare Advantage is the private insurance option that more than half of Medicare beneficiaries now use. Instead of the government paying doctors directly, it pays private insurers a set amount per patient. Those insurers then manage the care. The big question is how those payments are calculated. If the government reduces the amount paid to these plans, insurers may respond by increasing premiums, changing benefits, or narrowing provider networks. But if payments increase, it could mean better benefits or higher overall program costs for taxpayers. Another area of focus is prescription drug payments. Policy discussions have included changes to how Medicare negotiates or reimburses for certain medications. That could affect the cost of insulin, heart drugs, cancer treatments, and other essential medications that many seniors rely on daily. And then there are provider payment adjustments. Doctors and hospitals receive set reimbursements for services. If those rates change, some providers may stop accepting certain plans or limit the number of Medicare patients they see. So while the change may sound technical, just a tweak to payment formulas, it can have real-world consequences. It can shape the size of your monthly premium, the cost of your prescriptions, and even whether your local clinic keeps its doors open to Medicare patients. Why this matters to your daily life. You might hear about Medicare payment changes and think it sounds like something that only affects politicians or insurance companies. But the truth is, these decisions reach directly into your daily routine. Every time you schedule a doctor's appointment, pick up a prescription, or receive a medical bill, you're feeling the impact of Medicare's payment structure. If payments shift, providers may change what services they offer, how often they see patients, or what they charge. For example, if reimbursement rates drop for certain treatments, a clinic may stop offering that service. That could mean longer travel times, fewer appointment options, or delays in care. And for seniors living on fixed incomes, even small increases in co-pays or premiums can disrupt a carefully planned monthly budget. Think about a retired couple relying on Social Security and Medicare. They've planned their finances down to the dollar: mortgage, groceries, utilities, and medication. Now imagine their Medicare plan suddenly costs $40 more per month, or their prescription copay doubles. That change may not seem huge in Washington, But at the kitchen table, it can mean choosing between heating the home or filling a prescription. This is why payment changes matter. They're not abstract numbers in a government spreadsheet. They're the difference between affordable care and financial stress for millions of families. And that's exactly why so many seniors are watching these developments closely. The Medicare Advantage factor. One of the biggest pieces of this story revolves around Medicare Advantage plans. These plans have grown rapidly over the past decade, with millions of seniors choosing them for extra benefits like dental, vision, and gym memberships. But here's the key detail. Those extra benefits are possible because of how the government pays these plans. The payment formulas determine how much insurers receive for each enrollee. If those payments change, the plans themselves may change. Under certain policy directions, adjustments to risk scores, payment benchmarks, or bonus structures could reduce what insurers receive. And when insurers receive less, they often respond by adjusting plan offerings. That could mean higher premiums, fewer perks, or smaller provider networks. For seniors who have grown used to these extra benefits, that could feel like a sudden downgrade. A plan that once included dental coverage and $0 premiums might look very different after payment changes take effect. On the other hand, supporters of payment reforms argue that adjustments could reduce waste and keep the program financially stable. They say it's about protecting Medicare for future generations. But for current beneficiaries, the question is simpler and more immediate. Will my plan still cover what I need? That's why understanding these payment changes is so important. Prescription drug costs in the spotlight. Another major concern involves prescription drug payments. For many seniors, medication is the biggest monthly expense after housing. So any policy that touches drug payments instantly becomes a kitchen table issue. Discussions around payment changes have included how Medicare reimburses for certain medications, especially high-cost drugs. Some proposals aim to lower government spending, while others focus on shifting costs or negotiating prices differently. For seniors, the impact could show up in the form of different co-pays, new coverage rules, or changes in which drugs are included on plan formularies. A medication you've taken for years could suddenly cost more, or require extra approval steps. Imagine walking into your pharmacy expecting to pay the same amount you always do, only to find out the price has doubled. That kind of surprise can shake a fixed budget. Supporters of reform say these changes could reduce overall costs in the long run. Critics worry they could shift financial pressure onto seniors in the short term. Either way, prescription drug payments are a major part of this conversation, and they're something every Medicare beneficiary should keep an eye on. What doctors and hospitals are saying: payment changes don't just affect patients, they also affect the providers who care for them. Doctors, clinics, and hospitals all rely on Medicare reimbursements to keep their operations running. When payment rates change, providers have to make tough decisions. Some may limit the number of Medicare patients they accept. Others may stop offering certain services if they're no longer financially sustainable. In rural areas or small towns, this can be especially serious. Many hospitals already operate on thin margins. A shift in Medicare payments could determine whether a local facility stays open or closes its doors. And when a hospital closes, it doesn't just affect medical care. It affects jobs, local businesses, and the entire community. That's why provider groups often speak out when payment policies are proposed. They argue that stable, predictable reimbursements are essential for maintaining access to care. For seniors, the takeaway is simple. Payment policies don't just change bills. They can change where and how you receive care. The political debate. Behind the policy behind every Medicare payment change is a political debate about spending, efficiency, and the future of the program. Some leaders argue that reducing certain payments is necessary to control costs and prevent the program from running out of money. Others say that cutting payments too aggressively could harm seniors by reducing benefits or limiting access to care. Supporters of the Trump-style approach often emphasize market competition and private plan participation. They argue that giving insurers more flexibility can lead to better options for seniors. Critics, however, worry that payment reductions could lead to higher out-of-pocket costs or fewer available services. This debate isn't just happening in Congress. It's playing out in policy proposals, budget plans, and regulatory decisions that could shape Medicare for years to come. And while politicians argue over numbers and projections, seniors are left wondering how it will affect their next doctor's visit. What you should watch for next. If you're on Medicare, there are a few key things to watch in the coming months. First, pay close attention to your annual plan notices. These documents explain any changes to premiums, co-pays, or covered services. Second, watch for updates about prescription drug coverage. Even small policy adjustments can lead to noticeable changes at the pharmacy counter. Third, stay informed about provider networks. If payment changes affect your plan, your doctor or hospital may or may not remain in network. These are the details that matter most, not the political speeches, not the headlines, but the information that affects your care and your wallet. How to protect yourself. The best defense against unexpected changes is information. Review your Medicare plan every year, especially during open enrollment. Compare options, check provider networks, and make sure your prescriptions are covered. Talk to your doctor about any upcoming changes. They may know how payment adjustments could affect your care or recommend alternative plans. And most importantly, don't assume your plan will stay the same year after year. Medicare is constantly evolving, and staying informed can save you hundreds or even thousands of dollars. The hidden cost shifts you might not see coming. Sometimes, the biggest Medicare changes aren't the ones announced in headlines. They're the small adjustments that quietly move costs from one place to another. A payment formula changes. A reimbursement rate drops. An incentive disappears. And suddenly, what used to be covered easily now requires higher co-pays or extra approvals. This is what many seniors fear the most. Not a dramatic announcement, but a slow, steady shift that quietly increases their expenses. Maybe it starts with a slightly higher monthly premium. Then a specialist visit costs a little more. Then a prescription moves to a higher pricing tier. None of it seems shocking at first, but over time, those small changes can add up to hundreds or even thousands of dollars a year. For seniors living on fixed incomes, this kind of gradual cost shift can be especially stressful. You might not notice it in January, but by June, you're looking at your bank statement wondering why there's less money left at the end of the month. Payment changes can also influence how insurers design their plans. If they receive less funding, they may reduce extra benefits like dental, vision, or hearing coverage. They might increase deductibles or add more restrictions to certain services. So while the policy change may sound technical, the effect can feel very real. It can show up in your monthly bills, your pharmacy receipts, or the benefits that suddenly disappear from your plan. That's why it's important to look beyond the headlines and understand how these changes can slowly reshape your coverage. The impact on preventive care. Preventive care is one of the most valuable parts of Medicare. Annual checkups, screenings, and early treatments help seniors stay healthy and avoid more serious and more expensive medical problems later. But payment changes can influence how much emphasis providers place on preventive services. If reimbursements for certain screenings or routine visits decrease, some clinics may reduce the time or resources dedicated to those services. That could mean longer wait times for appointments or fewer preventive programs offered in your area. And when preventive care becomes harder to access, small health issues can grow into major ones. Imagine skipping a screening because the nearest clinic no longer offers it regularly. Months later, that missed appointment could turn into a serious diagnosis that requires expensive treatment. That's how payment changes can affect not just your wallet, but your long-term health. Supporters of payment adjustments argue that the system should reward efficiency and outcomes. But critics worry that if payments are reduced too much, it could discourage the very services that keep seniors healthy in the first place. For you, the key message is simple. Stay on top of your preventive care and watch closely for any changes in coverage or availability. At the end of the day, Medicare payment changes aren't just policy decisions. They're personal decisions that affect your health, your family, and your financial security. Whether these changes lead to savings or higher costs will depend on how the final policies are implemented. But one thing is certain, staying informed will be more important than ever. Because when Medicare rules shift, your monthly budget can shift with them. And the seniors who pay attention, ask questions, and review their options are the ones who stay in control of their care. So don't ignore these updates. Follow the changes, stay alert, and make sure you're ready for whatever comes next, because your future, your health, and your wallet depend on it.